Stomach ulcers, also known as peptic ulcers, are open sores that develop on the lining of the stomach. Imagine a small crater forming in the delicate tissue that protects your stomach from its own digestive acids. This is essentially what a stomach ulcer is, and it can cause a great deal of pain and discomfort. These sores can vary in size and severity. Some ulcers are small and may cause only mild symptoms, while others can be larger and lead to serious complications. Regardless of their size, stomach ulcers are a cause for concern and should be addressed promptly. The pain of a stomach ulcer is often described as a burning or gnawing sensation in the upper abdomen. This pain may come and go, but it often worsens on an empty stomach or at night. In some cases, the pain can be severe enough to interfere with daily activities. The impact of stomach ulcers extends beyond physical discomfort. Untreated ulcers can lead to complications such as bleeding, perforation of the stomach wall, and even an increased risk of stomach cancer. Therefore, it's crucial to understand the causes, symptoms, and treatment options for this common digestive ailment. The discovery of Helicobacter pylori, H. pylori, a spiral-shaped bacterium, revolutionized our understanding of stomach ulcers. This bacterium, often acquired during childhood, burrows into the protective mucus layer of the stomach lining, weakening it and making it susceptible to damage from digestive acids. H. pylori is a major culprit in the development of stomach ulcers, but it's not the only one. The long-term use of non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and aspirin, can also irritate and erode the stomach lining, leading to ulcers. These medications are commonly used for pain relief, but their prolonged use can have damaging effects on the digestive system. Other factors that can contribute to ulcer formation include smoking, excessive alcohol consumption, and stress. Smoking reduces blood flow to the stomach, impairing healing, while alcohol can directly irritate the stomach lining. Stress, although not a direct cause, can increase acid production and worsen ulcer symptoms. Understanding the various factors that can contribute to stomach ulcer development is crucial for prevention and effective treatment. By identifying and addressing these risk factors, individuals can significantly reduce their chances of developing this painful condition. In the past, stomach ulcers were often shrouded in mystery and misconception. They were frequently attributed to stress, spicy foods, and personality types. Treatment options were limited and often ineffective, focusing on symptom management rather than addressing the underlying causes. One common approach was the bland diet, which restricted acidic and spicy foods in an attempt to reduce stomach irritation. While this might have offered temporary relief for some, it did not address the root cause of the ulcers. Antacids were also widely used to neutralize stomach acid, but their effects were short-lived. The discovery of H. pylori's role in ulcer development was a game-changer. It paved the way for more targeted and effective treatments, including antibiotics to eradicate the bacterium and proton pump inhibitors, PPIs, to reduce acid production. This breakthrough revolutionized ulcer treatment, making it possible to cure ulcers rather than simply manage their symptoms. Modern ulcer treatment typically involves a combination of medications, including antibiotics, PPIs, and sometimes H2 blockers, which also reduce acid production. This multi-pronged approach aims to eliminate H. pylori infection, protect the stomach lining from further damage, and promote healing. Stomach ulcers can manifest in various ways, and not everyone experiences the same symptoms. Some individuals may experience mild discomfort, while others may have more severe symptoms that significantly impact their daily lives. Recognizing the potential warning signs is crucial for seeking timely medical attention. One of the most common symptoms is a burning pain in the abdomen, often described as a gnawing or aching sensation. This pain typically occurs between the breastbone and the belly button and may worsen on an empty stomach or at night. It may also be relieved temporarily by eating or taking antacids. Other potential symptoms include nausea, vomiting, bloating, and a feeling of fullness even after eating small amounts of food. Some individuals may also experience heartburn, indigestion, and a loss of appetite. In more severe cases, ulcers can cause bleeding, which may manifest as blood in vomit or black, tarry stools. It's important to note that these symptoms can also be indicative of other digestive conditions. Therefore, self-diagnosing based on symptoms alone is not recommended. If you experience persistent or concerning digestive issues, consult a healthcare professional for proper diagnosis and treatment. Diagnosing stomach ulcers has come a long way from the days of relying solely on clinical symptoms and invasive procedures. Today, a range of modern diagnostic tools allows healthcare providers to accurately identify ulcers and determine their underlying causes. One common diagnostic method is an upper endoscopy. This procedure involves inserting a thin, flexible tube with a camera attached through the mouth and into the esophagus, stomach, and duodenum. The camera transmits images to a monitor, allowing the doctor to visualize the lining of these organs and identify any abnormalities, such as ulcers. Another valuable tool is the urea breath test, which detects the presence of H. pylori in the breath. This non-invasive test is based on the bacterium's ability to break down urea, a substance naturally present in the body. If H. pylori is present, it will produce carbon dioxide, which can be detected in the breath sample. In addition to these tests, blood tests can check for H. pylori antibodies, indicating a current or past infection. Stool tests can also detect the presence of H. pylori. These diagnostic tools, along with a thorough medical history and physical examination, enable healthcare providers to make accurate diagnoses and develop effective treatment plans. Treating stomach ulcers typically involves a multi-pronged approach aimed at addressing the underlying cause, protecting the stomach lining from further damage, and promoting healing. The specific treatment plan may vary depending on the severity of the ulcer, the presence of H. pylori infection, and individual patient factors. If H. pylori is detected, antibiotics are a cornerstone of treatment. These medications work by killing the bacteria, preventing further damage to the stomach lining and allowing the ulcer to heal. Proton pump inhibitors, PPIs, are another essential component of ulcer treatment. These medications effectively reduce the production of stomach acid, creating a less acidic environment that promotes healing. In some cases, H2 blockers, another type of acid-reducing medication, may be used in conjunction with PPIs. These medications work by blocking a different type of receptor involved in acid production. Antacids, although not a long-term solution, can provide temporary relief from heartburn and indigestion. Lifestyle modifications also play a role in ulcer treatment. Quitting smoking, limiting alcohol consumption, and managing stress can contribute to a healthier digestive environment and support the healing process. It's important to note that self-treating ulcers is not recommended. Consult a healthcare professional for proper diagnosis and treatment. Preventing stomach ulcers involves a combination of reducing risk factors and adopting lifestyle habits that promote digestive health. While not all ulcers are preventable, taking proactive steps can significantly reduce your chances of developing this painful condition. One of the most effective ways to prevent H. pylori infection is to practice good hygiene. Wash your hands thoroughly with soap and water after using the restroom and before eating. Avoid sharing food, drinks, and utensils with others, especially if they are experiencing digestive symptoms. If you require long-term NSAID use for pain management, talk to your doctor about strategies to minimize the risk of ulcers. This may involve taking the lowest effective dose for the shortest duration possible, using enteric-coated formulations that dissolve in the small intestine rather than the stomach, or considering alternative pain relief options. Making healthy lifestyle choices can also contribute to ulcer prevention. Quitting smoking is crucial, as it not only damages the stomach lining, but also impairs healing. Limit alcohol consumption, as it can irritate the stomach and increase acid production. While this essay provides valuable information about stomach ulcers, it's essential to remember that it is not a substitute for professional medical advice. If you suspect you may have a stomach ulcer or are experiencing persistent digestive symptoms, it's crucial to seek prompt medical attention. Self-diagnosing and self-treating can be dangerous, as they may delay necessary treatment and potentially worsen your condition. A healthcare professional can perform a thorough evaluation, including a medical history, physical examination, and appropriate diagnostic tests, to determine the underlying cause of your symptoms and recommend the most effective course of treatment. Early diagnosis and treatment of stomach ulcers are essential for preventing complications. Untreated ulcers can lead to bleeding, perforation of the stomach wall, and even an increased risk of stomach cancer. By seeking timely medical care, you can increase your chances of a positive outcome and improve your overall digestive health. Remember, your health is your most valuable asset. Don't hesitate to seek professional help when you need it.